Let me welcome all my viewers once again today on Beyond Sugar. Beyond Sugar is created for all of you in scientific collaboration with RSSDI and Indian Society of Nephrology so that all of you can get reliable scientific information related to diabetes and its complications. We are doing today's program live on Facebook and YouTube, and I'm your host, Sanjeev Mehra. Not only we come to you on a daily basis and share and post a lot of information related to diabetes and its management, but we also invite leading doctors from across the country who can talk to you as a friend and answer the queries which you have in mind. Today, in the same context, I'm very glad to welcome Dr. Sujoy Majumdar from the city of Kolkata. Welcome to the show, sir.
Thank you.
We will be talking about Today we'll be talking about one of a very common queries which we keep on seeing, which you put on the chat, and that's around blood glucose monitoring, and more so self monitoring of blood glucose. Since monitoring is one of the important pillars in diabetes management, so it's important for us that we learn everything around us. But before we start taking your questions, let me formally introduce Dr. Sujoy to all of you. He's a leading endocrinologist, as I shared with you, in the city of Kolkata, and has fellowship of all major academic national and international associations. He has more than 2 dozen publications to his name in national and international journals, and also been an examiner for exams like MRCP in India. Currently, he is working as a senior consultant endocrinologist in Apollo Multispeciality Hospital in Kolkata. All right, sir. Before we move forward and start taking the questions on this, let me hand over the stage to you for your opening comments on this topic. So over to you.
Thank you, Sanjeev, for such kind words. And basically, what we're going to talk about today is a very important topic in the management of diabetes, that is self-monitoring of blood glucose. Now, what is very important, we have to understand that self-monitoring of blood glucose becomes particularly important where the blood glucose is fluctuating. Now, the standard practice in the majority of the diabetes patients is to go by the fasting, the post-meal glucose, and the HbA1c. Now, these particular parameters are very safe and I should say very effective reminders or effective assessors of the glycemic control only when the glycemic variability is not that much. But for example, if somebody is on insulin in some form, either on a 2 or 3 times daily insulin or on a basal insulin at some point of time, this particular things becomes very important. And also, it is also well known fact that if the HbA1c shoots up to a higher level, that means if the glycemic control becomes poorer, then obviously we need to know how the blood glucose is fluctuating throughout the day. And self-monitoring of blood glucose is an advocated and approved technique to find out how the blood glucose is fluctuating throughout the day. Not only does it increase the patient awareness, but at the same time, it allows the patients to know exactly where the blood glucose stands at a particular time of the day. Let me give you a very concrete example. Most of the people, when they're going by or when they're guided by the fasting and the post-meal glucose, they usually do a one first and one maybe 2 hours after breakfast or 2 hours after lunch. And in somebody whose glycemic control is poor, these two values, they do not tell you anything about what the glucose is at, say, in the evening or in the afternoon or before dinner or after dinner. So obviously, somebody who is getting a comprehensive and an intensive glucose lowering treatment, for such a patient, it is very important to have the glucose monitored at different times of the day. Now, depending upon what particular treatment regimen is followed, patients are advised to do a glucose monitoring at specific times of the day. For example, if the patient is on a basal insulin, the advice is to check the fasting plasma glucose. If the patient is on a basal bolus or a premix, we ask them to check not only the fasting but also the post-meal glucose at different times of the day. And this is something which is guided entirely by the patient requirement. There is no such thing as a definitive protocol which has to be followed by all patients, because as we all know, diabetes control is something which varies from patient to patient, and each and every patient have got their own specific problems. So based on that, basically the glycemic profile also changes and the pattern of self-monitoring of blood glucose also changes for each and every patient.
Well, I think that's a very comprehensive view shared by you in the beginning about the importance of self-monitoring and how different patients may require it in a different way. And then every patient is, of course, presented in a different way and may have different needs as well. Sir, can you also, guide our viewers on is there some reliable, data or from your experience that does it really helps the patient in reducing, their blood sugar levels over a period of time once they adopt self-monitoring? And secondly, what are the different methods of doing the self-monitoring of blood glucose?
Right. Okay. That's a very nice question. Basically, as I mentioned, that self-monitoring of blood glucose is something which varies from patient to patient and has to fit in with the diabetes pattern of the patient. Now, this diabetes pattern involves not only how the blood glucose is fluctuating throughout the day, but at the same time, we have to appreciate what is the lifestyle of the patient. What is the time when the patient takes his food? Like someone who starts the day with a heavy breakfast and does not have any significant lunch, or maybe the next big meal is at the time of dinner time, the glucose fluctuation will be different from somebody who starts the day with a small breakfast, takes a sumptuous lunch, and ends up with a sumptuous dinner. So, depending upon one of the first and important determinants of the relevance or the importance of the timing of self monitoring is decided by the food pattern, or rather the eating schedule of the patient. So this is one example. As I mentioned, in somebody who's got a well-controlled type 2 diabetes, whose HbA1c, for example, is below 7 or maybe even below 7.5, and doesn't have a very good difference between fasting and post-meal glucose, that patient can probably manage without doing a self-monitoring of blood glucose. But in somebody who's fasting, say for example, is a 70 or 80, post-breakfast one is a 280, pre-lunch one is down to say 105, and the post-lunch one shoots up to 200. So these sort of patients, they need a much more intensive self-monitoring of blood glucose. And self-monitoring of blood glucose, in addition to the fact that the patient and the doctor, both of them become aware whether blood glucose is surging, it also helps in patient define the eating pattern. I'll give you a very concrete example. This is an example of a nurse whom I still remember. I saw this patient, she was pregnant, and she was having a very high HbA1c, but she was coming in with fasting and post-meal glucose as advised at pre-breakfast, pre-lunch, and pre-dinner. Now all these readings were coming back as normal. We were completely in a fix. So in her case, what we decided was that we should to go out of the we should have some out of the box thinking, and we should do monitoring at some other times of the day. Now, as we know, the work schedule of the nurses is such that they finish their schedule at maybe at 2 o'clock. Until then, they do not have enough time to have food. So, what they did afterwards was that this particular lady was taking a very sumptuous delayed lunch at around 4:35. And when we decided to go ahead and do the self monitoring of blood glucose in this lady, at that point of time, we found that the blood sugar was shooting very high in the range of 200 to 50 plus, while all the other readings at other times of the day were staying more or less between 100 to 150 or maybe up to 180. So what we did was in such a patient we added an extra shot of insulin at that time when she was having that lunch, and everything fell back into place. I can see here a question coming up here from somebody called Mr. Bhanu Pratap, who says that I have a kidney problem with CKD stage 4, creatinine level is 3.3. What I'd like to know, what is your question?
Yeah. So, okay. So I think the viewer has shared only a situation. So if you have a specific questions, please do ask. Meanwhile, sir, I think for our viewers, Dr. Sujaya has given a very clear message. So don't go by here say that how many times this maybe blood glucose monitoring would be required by a patient to be done. This is clearly based on what kind of meal pattern you have and what kind of the disease pattern which you have, and your doctor will advise you that on which times you should be doing your self monitoring as well. Sir, there was another part of question which I requested you, that one is the basic. We know that people may have glucometers, and these days people may have multiple glucometers at home, and a prick method. And so is there some other method as well which you recommend as a doctor to your patients for
Oh
doing
yes,
the self
we
monitoring,
have
because that's the
nowadays,
most.
thanks to the technology. Yeah, thank you. Nowadays, thanks to the technology, we have got this continuous glucose monitoring system, or the CGMS, which is perhaps a much more accurate way of assessing what we talk about as a glycemic variability. In other words, we all what this is what I tell my patients, that blood glucose going up and down, it comes in the form of sea waves. And as we all know, that if you stand on a seashore, all the waves that do not come with the same height. And same thing with a diabetic patient whose glycemic variability is on the higher side, the blood glucose profile will not be the same on different days. So on one particular day, the blood glucose may be quite high, particularly when the patient is on a working day. But on the days when the patient is on leave, or for example on a Sunday when he's on a holiday, the blood glucose patterns can come down. Now, it is not perhaps a very practical idea to for the patient maybe 3 to 4 sets of reading every day, 7 days a week. So one of the ways by which you can circumvent the problem is basically by going to what is known as the continuous glucose monitoring system. And this is really advocated in people in whom the ordinary self-monitoring of blood glucose result. We know that the self-monitoring glucose that the patient brings over are okay, but the HbA1c is high. And it is in such a situation that the CGMS comes in very handy, and we can pick up those particular points and we can analyze those points where the particular blood glucose has shot up so high. Let me give you an example. We had somebody with just a similar situation. The HbA1c was high, and the self-monitoring glucose readings as presented by him to me during the consultation, they were reasonably within the normal limit. Now, when we took a detailed history, we find out that he has got a habit of slipping out of his office work every Friday to go for a lunch package. At that time, he shakes all the yolks of restriction and tries to indulge in a sumptuous meal. Now, this was something obviously just for a feel-good factor. He was not recording those blood glucose readings. Now, this is something which you have to appreciate. Most of the diabetes patients, they want to believe that everything is going hunky dory right. So when they're presenting to the consultant, the doctor, for the checkup, always try to present a brilliant situation that everything is going fine. Now, what happens most of the time is that they do not tend to hide these times they're actually enjoying the food, and it is a basic human nature. Whether they do not have this, you do not have that. It is a basic human nature, particularly I should say typical Indian, that ignore it, and but actually everything is not going fine. So in that sort of a situation, they're doing a CGM actually helps us in picking up those episodes, and it helps us to make the patient aware that what is exactly going wrong and how he can get it corrected. So this is a
Well, that's quite an interesting, story of a patient which you shared. And of course, we all know those patients who will wait for the day.
there's some network
Yeah,
issues here
I
again.
think there's
Yeah, can
some network
you hear
issues, so your
me
voice
now?
is dropping. But what I was saying, sir, that yeah, I can hear you. But what I was saying was that it's a very interesting,
Can you hear me
anecdote of a
now?
patient which you have shared. I can hear you now. Please carry on. Can you hear me?
Yeah. I mean, I think there are some connection issues here. So, but anyway, so basically, regarding the somebody with a chronic kidney problem, basically the problem is that there is a very high risk of hypoglycemia, and this glycemic variability about which we talked about right now, it becomes even more difficult at that time. So, in these patients, be very careful about not missing out a meal. Maybe withhold from taking the insulin when they're going for a dialysis sessions, because it's a known fact that blood glucose tends to drop down after the patient has had a dialysis session. So these are very careful about it. And it's always more important in such patients if the patient has got an advanced kidney, that EGFR is coming to this is the they are the risk of glycemia. You have to ensure you start them on short. You should have the food at the right time and monitor the blood glucose much more frequently than somebody who don't have a chronic kidney disease. These are the things that you have to be very, very careful about.
Okay. So now, sir, you have explained us, the whole pathway that how a patient should be monitoring it himself and what can be the different situations and scenarios. Now, sir, please also help us understand that generally, if what used to happen in early times is patient goes to a doctor after 3 months, whatever, test is done out there in the hospital, he sees and then the doctor advises. Now, let's say if a patient is doing his monitoring on a daily basis at his home, so what are the target values he should be feeling that this is comfortable? And why I'm asking this question is like, what should a patient do? Let's say suddenly if he sees that after a meal he does and the blood sugar is 240, then what's the recommendation? Should he adjust his meal, or should he call up his doctor, or next day should he visit his doctor? What do you recommend to a patient in such situation?
Okay, that's a very good question. Situation usually applies for people who are on individual a bit common. We advise that on the basis of a single. What we advise them to do is, for example, I'm just giving a very good example. Post reading high. He should be doing at the time is he should record the post breakfast for 3 consecutive or at least 3-day period of reading. Now, if all the post breakfast or a specific at a given time, consecutive readings which are low, in that situation you have to adjust the medicine, not on the basis of one single reading. And this is very, very important, because this is the mistake that most of the patients make. They find one reading has gone very high. Now, this one reading can go high because of multiple factors, as I think we have discussed in the past. That blood sugar is not only there are several factors, like how much food the patient is taking, how much exercise the patient has done. It is quite possible morning walk, particularly he did on this morning walk, we expect the blood sugar the properly all this history have to be taken properly before we change the dose of the insulin, because the reason is very simple. Because one single multiple same on consecutive days, one period of 7 days, have the dose of insulin the patient.
Okay. Okay, so we hear you, sir, on this. There is just a quick another question around that. While a patient does the self-monitoring of blood glucose at home, so are there any potential complications which may occur, or are there any common challenges which a patient may come across, and how does he overcome that?
Right. Okay. First of all, the home glucose, the glucometers that we use nowadays, they're very sensitive ways of picking up blood glucose values, and the process is generally without any complications. The only problem that can happen in patients who have got established peripheral neuropathy. Now we all know the diabetic neuropathy primarily they can affect your upper limb. So if you do not have a proper sense of sensation, where we're doing the can sometimes pose you may not pricking at the same point of time and again. But this is a very minor issue. Majority of the home glucometer readings are quite safe. There is only one problem which comes in patients on the same value. The patient dialysis often it so happens that the capillary glucometer that we are using for the recording the SMB, they may give falsely normal readings. This fact the patient is stabilized. Because we remember that patients are getting the prepared for dialysis is rich in fructose and the other non-glucose carbohydrate products. So basically, some of these machines, particularly the older ones, They record also this total carbohydrate. So what happens at the time is these patients, this particular patients who got an dialysis is showing it as normal, they must get a proper laboratory blood glucose done. This is very important. This particularly happens in patients who are on peritoneal dialysis. The result can be, I should say, there can be an error in the glucose assessment. So these patients should always have their confession.
Okay.
Apart from that, there's a case of the cell phone.
All right. So thanks for highlighting this, and also you shared your caution around the patients who are undergoing the peritoneal dialysis. That also brings me to a question that generally it is also felt that there may be accuracy issues in glucometers or the devices we use at home. So what's your take on this? How good is the accuracy level of the current SFBG tools? And secondly, does it require, a time-to-time validation at the labs or anything, which you recommend in this regard?
Nowadays, most of them have but you can by which you can calibrate. There's machines in the brand, some machines which you can do without calibration. So whenever a patient is starting on a particular glucometer, first he must know whether he needs yes or no. If he needs to calibrate the machine, there are specific instructions given that this calibration should be done after so many readings. So obviously, once the calibration is done properly, then there should not be any major problem, and the readings are as good. Now, previously there was this concept with one of the older machines because the venous glucose has got, I should say, a lesser problem. So what they say is that this was the previous concept that if somebody is having or in somebody who's trying to control his diabetes only on the basis of capillary glucometry, he should reduce that. He should reduce around 20% from capillary glucometry to corroborate with the venous blood glucose. That factor is completely gone nowadays. Most of the modern day glucometers are calibrated to give equivalent of glucose readings. This is one part of the story. But there are certain conditions when this situation, the patient is, for example, the patient is doing some push-ups and other things. In that case, the capillary glucometer reading may come back as somewhat higher than what you find in the venous blood glucose. So these sort of things one has to be very, very careful about. If the blood glucose reading is done for just after an exercise, and somebody tries to compare the venous plasma glucose with that of the capillary glucose, because of this exercise, what glucose is consumed, what that reaches the venous side is less in the circulatory levels. So this is one factor which has to be taken into account.
Okay. So largely, I think what Dr. Sujai.
I'm sorry, I missed out your second question. So can you please repeat that?
Yeah, no, the second thing which I was asking was that does it requires time-to-time validation on the lab as well of the results, just so as to be just mentally sure that my glucometer is giving the right readings?
Now let me be a devil's advocate here. The thing is that we are taking the laboratory glucose as a gold standard. But we know nowadays in our country, a lot of this blood, for example, from most of the patients is collected by a home collection system. And I've got absolutely no faith in the home collection system because ideally, the glucose, once it has been, the blood sample, for the glucose, once it has been collected, it must be stored pressure and immediately go into the laboratory. It's a common practice what we have found that this phlebotomist who visits the houses of different patients blood early in the morning and the blood is deposited maybe sometimes around 10 or 11. So by that time there is a strong possibility that the actual value of the blood glucose could have gone down. So I'm not convinced blood glucose collection done by a collection phlebotomist gives a very accurate result and it can be accepted as a gold standard. If the patient goes to the lab, gets the blood test done there, fair enough. that's fairly accurate and that is comparable with an SMPG. But if we take out this factor, I don't think there is no harm in it checked from time to time with the lab glucose. But again, as I told you, some variability, this may not give a true picture because most of the patients they tend to believe that whatever is the fasting and the post-meal value that is sacrosanct. Now, in somebody who is having a very good amount of glycemic variability, whom the blood glucose is fluctuating day to day, that one reading may not be representative of the total reading on all the 7 days. So, in that way, in somebody who is has got other problems like renal impairment or in such of this fluctuation is much more. Patients of type 1 diabetes, in whom the fluctuation is definitely much more, these patients should more be guided by the self-monitoring of blood glucose and the CGMS rather than by a lab glucose. And also for the CGMS, you need to recalibrate some of the CGMS machines. You need to recalibrate with an SMBG result, which has to be put into the machines from time to time, and so that the curves that we get correspond with real-time values.
Okay. All right. So I think what we hear from Dr. Sujoy is that he's assuring largely that these machines which we use for self-monitoring at home, they're largely accurate these days. But on quite a few occasions, it may require calibrations. Maybe once in 6 months, or just at least be sure through some validation process. Maybe going visiting a laboratory whenever you are going once in 6 months. Maybe that's the time you can cross check it. But he's not having a great faith on the home collection system in our country. But then, yes, I think if he is giving a caution, let's keep that in mind as well. Sir, since we're running out of time, I'll just take one last question, or maybe a couple of them. So once a patient has a report with him that my blood sugar level is this and this is going up or down, there's also very high temptation to adjust the medicine also on its own. So now you suggested, like earlier, on adjustment of the fooding patterns or the exercises, but this is a sensitive topic around the self adjustment of medicine. So what's your guidance and viewpoint on this to the viewers?
Well, self-adjustment of medicine is allowed for somebody who has got proper knowledge. So the four pillars of diabetes management, one is diet, one is exercise, one is medicine, and the fourth pillar is education. So how much the patient is educated? By education, I do not mean, say, the professional qualifications or the professional degrees. Even a farmer can have a proper education about diabetes. So this does not depend on his baseline educational level or educational knowledge. What is important is that the patient, before he makes an adjustment of the dose of the medicines, be it insulin, be it tablets, whatever, he should have a proper knowledge and a proper capacity of analyzing why the blood glucose is going up. So whenever the blood glucose is going up or going down, the patient, why is this happening? You cannot say, I do not know why it happened. If you do not know why it happened, that's it. Cannot be, you're not competent enough to. If you know why it has happened, only then you can adjust the dose properly. So a proper education of a patient is very much important. And as in diabetes, as we were always taught, that patient self-empowerment is very important. But this empowerment should come with on the background of education. So if the patient is educated enough, if he can analyze why the blood glucose has gone up or gone down, and if he is following, the doctor is thinking that if 3 or 4 readings at a particular time of the day are abnormal, then there has to be a reading that probably and then you have to find out what is the reason. Suppose the patient has got an infection. We all know infection, and obviously at that time the blood sugar tends to shoot up. And in that sort of a situation, the patient is well empowered to increase the dose of the insulin. But he should know why he's doing it. Without that why, the what often becomes a very skeptic sort of thing. It doesn't always reflect a rational adjustment of the dose of medicine.
Yeah. Yeah, so I think that's very important, and he mentions that education, self-education about of the patient is extremely important and one strong pillar, and that's what we try to do at Beyond Sugar, continuously try and strengthen that fourth pillar of diabetes management, where the caregivers and the patients themselves can be educated about the larger disease part as well. So just before we conclude, one final question on this. Earlier, we had some network issues, so I just couldn't hear. If you can emphasize and repeat again for us that are there any specific, group of people with diabetes who must adopt SMBG or self-monitoring, which would be very, very vital for their disease management? Maybe, like a type 1 or during pregnancy. Is it any guidance you have on this?
Yes, I think the guidelines on them. In fact, we wrote one on this about 10 years ago. I was one of the authors there. What to recommend? Type 1 diabetes, it's mandatory to have a self-monitoring of blood glucose. Patients having type 2 diabetes who are needing insulin on a regular basis. So patients who have got a beta cell failure, or where the patient a type 2 diabetes is behaving like a type 1 because it needs multiple shots of insulin throughout the day, they need to have a self-monitoring glucose. It is really a fasting therapy. Patients who have comorbidities like renal failure, liver failure, patients in whom the food intake is variable. For example, patients who have had a stroke, but you stick onto a proper dietary pattern, not have the food in the right way as it is recommended. So, in such patients, where we expect the blood glucose to go up and down in a very random fashion, these people need a proper self monitoring of blood glucose. Gestational diabetes definitely is, because gestational diabetes is a dynamic situation where over a span of few weeks we can see the diabetes blood glucose patterns going haywire. So these patients definitely need a self-monitoring of blood glucose, because otherwise it will have an effect not only on the mother but also on the unborn fetus. So these are specific groups for whom diabetes monitoring with self-monitoring of blood glucose is mandatory.
Yeah, thank you so very much, Dr. Sujay, for emphasizing this and highlighting this. So with this, we'll conclude this program. And I must thank all my viewers, who may have watched us live today or who would be watching this program later on as well. Now, if you have anyone in your family or in your friend circle who has diabetes, so you can simply share the link of this program with them, and this discussion can be very useful for them that how they can do the self monitoring of blood glucose. So with this, I'll, sir, Dr. Sujoy, back to you, and I thank you as well. Just in case, if there's anything important which is missed and you still want to highlight or summarize some important points, I give it back to you to conclude.
No, I think we have discussed all the more important issues. And obviously, if anybody has got any questions based on this, like this gentleman who had this question on the chronic kidney problem, if there are any further questions, I'll be happy to take them on later on. Thank you so much, and thanks for giving me a chance to deliberate on this particular topic. Thank you.
Thank you so very much. So we thank you, Dr. Sujoy, all our viewers who joined us today or will be seeing later. If you have more questions around this topic or you want to have some greater knowledge around diabetes or talk about it, you can go and visit Dr. Sujoy if you are in the city of Kolkata. If you are somewhere else in other city, please don't ignore these issues and follow the advice of your nearest expert doctor in this who can help you well. So thank you so very much, all the viewers. Dr. Sujoy, thank you very much. Good night and take care.
Good night. Thank you very much.